Good morning. My name is Katrina Moog, and I'm responding to discussion board question about the simulation that I viewed between the nurse and the mother who just delivered and her newborn baby. And I'm referring to the 6 questions from the debriefing guide. And the first question, tell me where you saw care exhibited in the scenario. Even though the nurse obviously cared for the patient, her affect was very flat. She showed no emotions to the patient. It did not seem as if the nurse had developed a relationship with the patient. And some examples of behaviors I observed that showed that there was not a caring relationship. When the patient voiced concerns about going home on Percocet, this should have led the nurse to do a pain assessment to evaluate if ibuprofen was appropriate for her pain. There was no discussion other than the physician decided ibuprofen is best for her and that's what she will go home on, and that if she wanted Percocet, she could get it in a couple weeks. And I just did not see very much caring or compassion from the nurse with that. Also did not see the nurse trying to engage the mom in the care for the baby. And I've always thought that teach back is the most appropriate method to evaluate a patient's readiness for discharge. And the nurse just walked through the motions of changing the baby. The baby wasn't even facing the mom. And she should have actually had the mom do the care for the baby to determine whether or not the mother understood. But the nurse just seemed very hurried. And even though maybe she did care for the patient, it was difficult to get that from this scenario because she was in such of a hurry. It was difficult to assess what the patient's priorities were. Other than her asking for a prescription for Percocet, there was really no conversations held by the patient with the nurse. This could be improved if the nurse were to ask open-ended questions that could really assess how the mom was feeling. Maybe the mom was just extremely overwhelmed with taking the baby home and this was her way of coping. But you really couldn't make a determination one way or another what the patient's priorities were. From the nurse's point of view, it was obvious she was hurried. There were patients waiting for a bed, so she needed to hurry up and discharge this patient. She did voice concerns to her fellow coworker about the patient's readiness to go home, but she did not reach out to any referrals. She didn't ask for any additional consults. She just basically knew that the mother wasn't going to be able to take care of the baby at home, and I didn't see her complete any actions to do that. And that's very concerning that the patient was going to be discharged home with a boyfriend, and there wasn't even an assessment about a car seat. So the nurse's priorities really should have been making sure that it was a safe discharge. As far as resources that should be made available to this type of patient, of course, home health services are always available, even if it's just for a few short visits to go out to see her, to assess that the baby is being taken care of, since that is the biggest priority, is the safety of the baby and the mom. They need to make sure that she does know how to feed the baby appropriately, the baby is receiving nourishments, that they're changing diapers, they're bathing the baby safely. There are so many factors that home health can be great resources for if they receive the referrals. Also, this may be appropriate for a social services referral. The nurse mentioned that the mother has a history of drug abuse or addiction. So definitely there's a concern there, especially in my area, in my region, York County and Newport News. There is a huge drug problem where children are being left neglected so parents can go out and get the drugs. So that would be one of my biggest concerns, to make sure that social services is aware of the environment that the baby's being discharged home to. How would I transfer what I learned from this scenario? This could be applied to any setting. Basically, you have to assess what your patient knows before you can start any teaching. And first of all, ask open-ended questions, use the teach back method, and make yourself available for any questions, hand out literature. You have to be sure that when your patient walks out of the hospital and they're no longer in your care, that you have done everything possible to make sure that it is a safe transfer. If you are made aware of certain situations that could potentially become problems, it's your responsibility as a patient advocate to follow up on those issues. Thank you.